Good morning and welcome. My name is Dr. Joan Reed. I am Dean for Diversity and Community Partnership and Professor of Medicine at Harvard Medical School and a professor in the Department of Social and Behavioral Sciences at the Harvard T.H. Chan School of Public Health. And I am also the director of both the Commonwealth Fund Fellowship in Minority Health Policy at Harvard University and the Joseph L. Henry Oral Health Fellowship in Minority Health Policy. I welcome you to today's informational webinar on the Commonwealth Fund Fellowship in Minority Health Policy. A few housekeeping notes before we begin. All lines are muted and the chat function is not available. Live closed captioning is available and you can turn that on. The webinar recording and these slides will be available on the Commonwealth Fund Fellowship website. And please submit your questions throughout the webinar through the Q&A box located at the bottom of your screen. Our agenda for this afternoon: first, Dr. Lori Zephyrin will provide an overview of the Commonwealth Fund. Then I'll share a brief overview of the fellowship program, followed by you hearing from fellowship alums, both current fellows and alums of the fellowship program, sharing information on their experiences, and we'll conclude with a Q&A. Our speakers today will include Dr. Zephyrin from the Commonwealth Fund, current fellow, Dr. Jessica Pierre-Francois, and alumni fellows, Dr. Mary Fleming, Dr. Jodian Pinkney, and Dr. Alden Langry. It's now my pleasure to introduce Lori Zephyrin. Dr. Zephyrin is Senior Vice President for Advancing Health Equity at the Commonwealth Fund. Dr. Zephyrin has extensive experience leading the vision, design, and delivery of innovative healthcare models across national systems. And with that, welcome, Dr. Zephyrin.
Great. Thank you so much. I'm so excited to be here today. Just about to share my slides. I just wanted to share with you today a little bit about the Commonwealth Fund so that you have a sense of what we do and what we fund. We're actually a foundation, a philanthropy, and we kind of function as both a philanthropy and a think tank. We fund research, we fund programs to help drive leadership as well. And so I'll talk a little bit about that today. And thank you, Dr. Reed, for your introduction. And so the Commonwealth Fund, our mission is to promote a high-performing, equitable healthcare system to really drive better access, better quality, particularly for society's most vulnerable. And in terms of our values, how we do our work, it really guides us as an organization in our work and in our interaction with each other and others, both internally and externally. We strive to be bold and impactful. We center community and our common humanity. We anchor equity and integrity in all we do. And we strive to work in a collaborative and joyful environment. And so we're an independent, nonpartisan organization. We were established in 1918 as a private philanthropy. It's one of the first philanthropies actually started by a woman in the United States, Anna Harkness. And we make impact by leveraging policy, practice, and leadership development in key areas around coverage and affordability, care and equity, cost and climate, and international learning and leadership exchange. And equity is one of our core programs and our largest program at the Commonwealth Fund. And actually in all our work across coverage, affordability, delivery systems, cost and climate, and international learning and practice, equity is really cuts across our organization as a key priority. One of the things that I just wanted to highlight is leadership development is key to our impact pathway. And as we think about how do we help drive an affordable, equitable, high-quality healthcare environment, policy is really critical and practice is very important. We support and fund work and do work internally to generate evidence, recommend policy solutions based on this evidence, and by talking to experts, we create momentum, raise awareness, and ultimately hope to inform action to really drive equitable, high quality healthcare. And leadership development is a key part of this as well, because all of you who are on this call and listening to this are obviously interested in leadership and leaders in your own right. And so, our goal is to help support leaders taking action, enhancing knowledge, skills, and opportunities, raising profiles and cultivating networks, and identifying leaders and partners. And so in our Advancing Health Equity program, which is one of our largest programs at the Commonwealth Fund, our goal is to eliminate unequal treatment, experience, and outcomes in health and healthcare for people of color by addressing systemic racism in healthcare policy and practice. So our goals are to drive implementation and development of policies that advance health equity, and also equip healthcare stakeholders with the necessary tools to ensure equitable and high quality care across delivery systems, which we include as healthcare systems and communities. And you'll see a connection between sort of our impact pathways and our goals. Leadership plays a key part of this. In terms of our focus area around health systems, ultimately, we want to equip healthcare leaders with the necessary tools to drive equitable healthcare. So whether that's sparking investment ideas to advance community-led solutions, whether it's identifying best practices, or whether it's supporting work to drive health equity measures that can promote accountability, all those are critical in equipping healthcare leaders with these necessary tools. In terms of the policy aspect for driving implementation of policies that advance health equity, we strive to show the equity impact of policies. There are a range of policies, whether we're talking about reproductive health policies, some of which can have positive or negative impacts, particularly on marginalized communities. Our goal is to be able to communicate those impacts to policymakers and system leaders and drive change, or whether it's convening multi-sector leaders to discuss opportunities to drive equitable policy change is another key area of focus and activity of our work. That our Health Equity Fellowship as an extension of our goals in advancing health equity and our goal across the Commonwealth Fund, we strive to increase diversity in senior leadership positions in health policy and systems, have a cohort of leaders that are focused and prioritize improving healthcare delivery for historically marginalized populations, leaders that can shape the discourse and design of healthcare policy, increase the dedication of health systems to improve health equity, and really fostering health systems change to create more healthier and equitable communities. And so leadership is a key part of our goal to really drive an equitable healthcare system. If you go to our website, you can learn more about our work. These are just some examples of some publications through the Commonwealth Fund that you can see on our website, from our state scorecards to around women's health or advancing racial equity, to work around polls of healthcare workers and their observations of discrimination against patients. And so I'll just end here and just say, thank you for being here. Without all the work that we do, it really relies on a great team. And so in Advancing Health Equity, we have our program officer and program manager of Advancing Health Equity, and really excited to share with all of you our work, and excited about supporting this fellowship in minority health policy led by Dr. Joan Reed. And again, if you have any questions, please feel free to reach out to us or follow our work through our website or on Instagram. Thank you so much, and I will pass it back to Dr. Reed.
Thank you. Thank you, Dr. Zephyrin.
Thank you.
And before we hear from our current and our alumni speakers, I want to provide you a brief overview of the fellowship program. And there are three primary goals. The first is to prepare physicians to become leaders who will have an impact on the health of historically marginalized patients. And a second, to increase this representation of well-trained, creative physician leaders who will impact multiple areas, from health and healthcare delivery, government, foundation, private, academic sectors, in ways that impact policies and practices and programs But the third goal is this is not a one-time sort of interaction, but continued career development and continued career advancement for our alumni fellows. Next slide, please. If we look at the fellowship, started in 1996, so we're looking at 28 years, all of our fellows have remained committed to issues around policy, practice, programming, minority health, and vulnerable populations. They are in multiple sectors from the academy to public and private, have had many honors, publish, have grants, serve on multiple committees from the local to state to federal levels, and the majority, 80%, have or have in the past held academic appointments in medical schools and schools of public health. Next slide, please. For eligibility, the physicians who've completed residency and are either board eligible or board certified, so that is a requirement, U.S. citizenship or permanent residency, and evidence of leadership experience and potential for leadership, and a clear commitment to historically marginalized populations. Benefits include a stipend of $80,000, full tuition at the Harvard T.H. Chan School of Public Health or the Harvard Kennedy School of Government, health insurance, books, travel, program expenses, funding to help towards practicum, and probably the most critical part of this, a network with other fellows. Next slide. Offerings include the degrees, as I mentioned, Harvard Chan School of Public Health, it's an MPH and an MPA from the Kennedy School. Fields of study for the MPH include health management or health policy, and there's cross-class registration across all of our Harvard faculty. So if you think about the Kennedy School, the Education School, Business School, Medical School, and for the 2024 academic year, it will be in person. There may be some virtual activities, but the coursework will be in person for the year. And you can see here multiple course requirements from biostatistics and epidemiology to seminars in leadership and minority health policy, decision analysis, touched on healthcare quality, innovation, and entrepreneurship, very broad. Next slide. The fellowship overview itself includes leadership forums, skill development, seminar series, journal club, special sessions on op-ed writing, practicum, mentoring from faculty within our Harvard system, members of our advisory committee, alumni fellows, and group and individual meetings. Fellows also attend national conferences such as Academy Health, have a leadership day with leaders from across the Mass General Brigham system, site visits that are both national and local, shadowing leaders in health policy space, and an annual meeting where fellows present the work that they've done during the course of the year, but are also joined by alumni fellows and members of our larger community. Next slide. Activities are really around building personal narrative and understanding our own personal narratives, expanding career networks, fostering an understanding of systems and systems within systems, and connecting to leaders and leadership policy programs, both within our Harvard system, but more broadly in the leadership and policy programs that are sponsored by the Commonwealth Fund, and strengthening alumni connections. Next slide. For more information about the fellowship and how to apply, you can see here the phone number as well as the email address. The application deadline is December 1st, 2024, and 2 applications are required, an application for the Commonwealth Fund Fellowship, as well as those applying for an MPH from the Harvard T.H. Chan School of Public Health, Master of Public Health. They must apply, or you must apply to that MPH program. Or if you're applying for an MPA, you must apply with an application for the Kennedy School Master of Public Administration. Next slide. Some examples of the paths that our alumni fellows have taken. It really, as I mentioned earlier, has followed multiple career paths from private sector, and you see fellows here who are with WellPoint and Centene, from the federal government and public sector with PCORI and with the Office of Minority Health, academe, individuals who are in pediatrics and cardiology at Baylor, to individuals who are leading programs around indigenous health at Johns Hopkins, individuals who are working in community sites, such as those in Florida and at state level with the University of Maryland. So really across the board. Next slide. And our current fellows include individuals in psychiatry and pediatrics and emergency medicine, individuals from our local New England area, but individuals who also hail from across the country. And our fellows are also joined by dentists who are part of the Joseph Henry program. And with this, I'd like to now turn the program over to our alumni fellow and the president of the Reed Scholars, Dr. Mary Fleming.
Good morning. Good morning. Thank you so much, Dr. Reed. Always great to do this. I look forward to it every year. Always great to be refreshed on what the Commonwealth Fund has been doing and is doing. So good to see you, Dr. Zephyrin, and lovely to be joined by the rest of the Commonwealth Fund Fellows and Reed Scholar family. So I will be brief and just share a couple slides with you this morning. If my computer works with me, because as long as we've been doing anyway, as I was actually reflecting on this conversation that we were going to have this morning, and I just thought about it, looking at the current and new fellows. I was like, oh gosh, yeah, we've been gone for quite a long time. But the reality is that this experience never leaves you. And I think you will hear probably a recurrent theme from the other presenters this morning, that it is definitely a family affair um, from the first day. These are my cohort. And we had a instant connection that we bonded from going to concerts together to going to baseball games together. That's a picture of us with Martin Luther King III on one of our field trips, if you will. But we really learned how to be both colleagues in study groups and helping each other get reoriented to the academic space. But also supported each other in being whole people. And I think it's very important when we do the long work that health equity requires, is to facilitate this network of professional and personal colleagues that are willing to grow with you together. And I think the second part is you don't just get your cohort, you also get, as Dr. Reed mentioned, the network of fellows. And that is what culminates into the Reed Scholars. So the Reed Scholars is the alumni portion of all three fellowship programs. So today we're discussing the Commonwealth Fund Fellowship, but the other three fellowship programs that Dr. Reed mentioned at the beginning of our presentation also feed into the Reed Scholars. So we are a collection. Excuse me, I know what's happening to my voice this morning. We are a collection of physicians and dentists who are collectively and individually working towards health equity across the country, and some of us dabble into the global space as well. We do support each other throughout the year with networking activities with the current fellows, but also just support on job seeking, on project building, on research projects, on resources. But we also meet as an organization through our general business meetings, our board meetings, our annual leadership retreat. We also have an annual health equity symposium. Next year would be its 16th year, as well as we have an interactive podcast, which we launched in December of 2019. So we're coming up on our 5th anniversary of that as well. But what I would like to leave you all with is, if I had I had no way of knowing what the possibilities could be when I was thinking about this program, and the return is way beyond the investment. I could not have imagined that I would be president of Reed Scholars for 10 years. I still have a hard time wrapping my mind around that, but it has been such a rewarding experience. This fellowship also has allowed me to be director of another health equity leadership program through the Harvard School of Public Health and their executive and continuing education division, which allows us to continue the health equity conversation with health professionals broadly, again, across the country. We also have international participants. We have a customized in-house program with a very large insurance payer now that is even more exciting about, as Dr. Reed talked about, our reach as fellows into the private sector and their commitment to having health equity conversations across their company, also across the country, including Puerto Rico. So it's just an amazing opportunity. I have the great opportunity to invite our fellows and Reed Scholars to present in these programs. So Alden and another fellow, J-Bot, and I were together yesterday presenting in the customized program, and we just had a really good time. And so I will leave you with that. This program is not just all of the didactics and the check boxes and the degree. It is really the promise of possibilities that you will not even realize, and you will continue to realize into years to come. So please, if you have any questions for me, feel free to reach out through email or LinkedIn is always the best way to find me. But I encourage you to strongly consider the program, and it will clearly be one of the, if not the best year with it. So with that, I will turn.
Thank you, Mary. Thank you. And now we're going to hear from one of our current fellows, Dr. Jessica Pierre-Francois.
Thank you, Dr. Reed. Let me just share my screen. All right. Good morning, everyone. Thank you so much for joining us today. My name is Jessica Pierre-Francois. I was born and raised in Boston, Massachusetts, did my pediatrics training at Mass General Hospital, and I am currently a community health pediatrician at a Boston federally qualified health center called Codman Square in Dorchester. And I'm also one of the current fellows. And what I wanted to share with you guys today was really, why did I pursue the Commonwealth Fund Fellowship? And primarily, the reason why I pursued this fellowship was during my training, I really felt like there was a period of where I had questions, I had frustrations, and I wanted to understand, is there more that I can do? Particularly, I entered my training during COVID, and I saw a lot of things going on. And one thing that really lingered with me was pediatric mental health inequities. And I was seeing it in the inpatient setting. And when I went back to community, working at a community health center, I was also seeing it there. And I got jaded and frustrated with the system, thinking, is there more I can do? And so when the opportunity to learn about this awesome fellowship, I quickly ran for it. And I can tell you, I do not regret my decision at all to this day. This fellowship has really been transformative over these past year and a half of me really kind of delving into some of the areas that I am particularly passionate about, which has been pediatric mental health. And as Dr. Flemings has mentioned, it's not just a group of physicians you put together where we're completing tasks, but you really kind of form a family. And I wanted to share with you guys some of the experiences that I've gone through the fellowship this year, including one, going to DC for our DC fellowship policy week, meeting several different organizations who really kind of open our eyes to what can you do outside of maybe just seeing patients day to day, but kind of addressing social drivers of health more at a systemic level instead of at a more local level. In addition, we've had tremendous opportunities in terms of networking with actual fellows. So at the bottom right, that is Dr. Wando, who's a family care physician, a world-renowned a leader in healthcare transformation. So just being able to sit with her and have lunch and learn about her journey. Why did she pursue the fellowship? Areas in her career that she took that kind of led her to where she was. So just having that opportunity and that network of individuals and professionals just to kind of flesh out ideas has been absolutely invaluable. And then another amazing opportunity that arose was just meeting and hearing from Justice Jackson, as you can see at the bottom left, just kind of hearing her journey. So just having that exposure and having those experiences have really been kind of, for me, life-changing. And I think throughout this fellowship, just getting that experience, meeting and networking, kind of fleshing out my ideas to see how can I, seeing something that happened on the clinical side, having questions, being frustrated, but having this opportunity through this fellowship to explore ideas to address that has been amazing. And I've also shown some pictures of our current fellows. Most recently, we're in New York for Policy Day in New York with Dr. Zephyrin. So just kind of learning more about the Commonwealth Fund Fellowship and also collaborating with other fellows at the Yale cohort. So I didn't want to just linger on a lot, but I just wanted to give you guys the opportunity to see these are the endless things that you can do through this fellowship. I think any area of interest where you really want to dig a little bit deeper into a question or wonder why is something happening, this fellowship has really provided me with that opportunity. I feel like I'm so fortunate that I've been part of this fellowship, and that I not only been able to explore a question and idea, but also gain a family and a network, which I can rely on when things get tough or I just need some support. So I don't want to linger too much. I want to give everyone an opportunity to share their thoughts and experiences, but please don't hesitate to contact me if you have any questions.
Thank you, Jessica. Our next alum speaker is Jodian Pinkney. Dr. Pinkney is an instructor in medicine at Harvard Medical School and an assistant in medicine in the Division of Infectious Disease at Massachusetts General Hospital.
Thank you, Dr. Reed. Let's see if this will be shared. And putting it on full screen. And are you guys seeing the slideshow? Yes. So this fellowship has been absolutely amazing. I will say I started off not originally in this country. I'm originally from Jamaica. And my interest in public health started when I was working at the Center for HIV/AIDS Research and Education Services there. And I will say we were doing a lot of health equity work, but I didn't realize that was what we were doing at the time. So we did a lot of mobile clinic outreach to get people tested. But even with that, the youngest person I diagnosed was 6 years old. And I realized there were lots of systemic failures that happened for that child to now be infected with HIV, including access to care for his mother, access to getting a primary care physician who could help her. And even beyond that, what was her access to employment and education before, and really thinking about the upstream pictures. I did not have that concept or that framework while I was working there. And I think that's when, that's one of the benefits of this fellowship. It really gets you to see the big picture because we have legends and visionaries for health equity in this program. So I actually ended up starting my infectious diseases fellowship at Mass General in 2020, so right smack in the pandemic. And that really revealed so many health disparities that were happening in the United States because, as you know, the minority population was terribly affected by the pandemic. And particularly my area of interest was with pregnant persons or birthing persons, where their maternal mortality related to COVID-19 was disproportionately affecting our Black and Hispanic pregnant people. And so I was working with this legend and visionary, Dr. Bisola Ajikutu, who was my mentor during my infectious diseases fellowship and happened to be one of the alumni of this great Commonwealth Fund Fellowship. And she was doing a lot of work on vaccine hesitancy in the minority community. And we basically put together a research project where we were investigating vaccine hesitancy, particularly in Black women and also in Jamaican women. And that's when I got introduced to a lot of the structural and systemic inequities and really had to learn about the root causes of medical mistrust in the United States and really get that framework going, from even redlining and all of those policies in the past that affect the outcomes that are happening now. A lot of the medical mistrust stories, for instance, tends to center around Tuskegee, but Tuskegee is just a drop in the bucket to the larger systemic problems that are going on at the government level and in the healthcare system, et cetera. So with Dr. Adekuta's expertise, she's like, you should definitely apply to this. I think it will open your eyes a bit. And I did, and then met the extreme legend here that we have in our midst today, Dr. Joan Reed. And when I say a visionary, I mean, thinking back to where the program started in 1996 and just the impact and the footprint of people that she's been able to mentor and champion for health equity throughout that time is just amazing. And I've learned so much from her. And I think anyone doing the program will just be absorbing knowledge and richness of knowledge of how to really influence health equity at multiple levels in both the private and the public sector, which is just expansive for a physician to think about, because a lot of the times, as Jessica said, we are thinking about individual patient care or an individual hospital, but to see the broader picture of how that fits into the healthcare system overall was really just a transformative experience for me. Also, as Jessica said, we get to meet so many leaders in the space. This was our trip to DC. And I'm talking about leaders even beside me. Nana is one of the leaders of the nonprofit Harvard Fund, which looks at delivering healthcare to minority or underserved communities. Got to meet one of my favorite people, Dr. Walensky, the former CDC director, who was able to declare racism a public health crisis in America and the impact that made in terms of having available upstream funding for these health equity initiatives. And also got to meet the legendary T.H. Chan from the T.H. Chan Public Health School at graduation. So it really was a transformative process that helped me to understand the larger picture of what goes into health equity. And the return on investment has been amazing. So I just graduated in May of this year, and already I've gotten Bridging the Gap Culturally Competent Care paper for Alzheimer's disease published in the Harvard Public Health Review. And this was basically from the project we were working on in the minority health leadership class with Alden Landry, who you'll hear from next. I've also now understood how to write an op-ed and how important that is to disseminate information, not to an academic space, but more to, a broader audience, and really getting the messages of what information is important, what data is important to understand health equity to all levels. From the introduction to US health policy class that you guys will have with John McDonough, I really learned about the CMS payment systems, particularly related to value-based care, and was able to see how that was affecting our outcomes, particularly racial disparities in periprosthetic joint infections, as the Affordable Care Act had some specific funding for joint replacement therapy and their monitoring thereafter, which hospitals can opt in and opt out of. And so the impact of value-based care and how that can reduce racial disparities in joint infections was something I learned during this fellowship. And then for my practicum, I was able to get that accepted to the National Immunization Conference hosted by the CDC. And I was there presenting the data on the disparities we noted with transportation insecurity and its relationship to flu vaccination in the pregnant population. It was also presented at the Infectious Diseases Society of Obstetrics and Gynecology, where it won the Best Poster Award. So this is all within the last 6 months of me graduating. So I can only imagine what the future holds. So with that, I will just say I am extremely grateful for everything that Dr. Reed and this program has done, all the networking that has happened, and all the tools that I need to really integrate health equity in all spaces that I am and understand all the levels impacted by it. And you will too.
Thank you, Jillian. Our final alumni speaker will be Dr. Alden Landry, who is an assistant dean in the Office for Diversity Inclusion Partnership, Harvard Medical School, an associate professor in emergency medicine at Beth Israel Deaconess Medical Center, an associate director of the Commonwealth Fund Fellowship in Minority Health Policy at Harvard University, and associate director of the fellowship that he completed as part of the class of 2010. Dr. Landry?
Thank you, Dr. Reed, for the introduction, and thank you for everyone who is joining us. I do not have any slides because I really want to double down on some comments that were made by the previous presenters. And I think we can do that with a conversation and then really turn this over to an opportunity to try and answer as many questions as possible. As Dr. Reed mentioned, I did complete the fellowship, and I was one of those individuals who, like many of the speakers before, were coming from a space of frustration and looking for a way to turn that frustration within our healthcare system into action. And I think that's one of the opportunities that's really ingrained in this fellowship. You come in thinking about a problem and you leave with not necessarily solutions to the problem, but techniques, networks, experiences, life lessons, conversations, to go out and attack whatever problems that you are considering addressing that you see in your specialty or that you see in the healthcare system across the board. I just want to really emphasize that this is a growth opportunity. And many times the fellows come in with one specific area that they're thinking about from a career perspective. And oftentimes they leave on a completely different trajectory. And that's not necessarily a bad thing. I think we have our experiences and our exposures early in medicine that lead us to a particular place, but then we have these inflection points that help to transform our career so we can do things that were not necessarily within our vision before starting the fellowship. This is open to people who are looking to learn how to lead and how to address complex problems. This is not just an opportunity to come and get an additional degree and maybe add a couple of trinkets to your CV. This is a chance for you to really think about how you can have a larger scale impact on the issues related to health equity that our country is facing. This fellowship is open to individuals at various stages of their careers. As I mentioned, I did the fellowship fresh out of residency, but there are other fellows that come at different stages in their career, whether it be mid-career after working clinically and seeing problems that they want to address, or even individuals who are coming in towards the later stages of their career where they've practiced clinically for an extended period of time. And now they're ready to make that transition into whether it be administration or leadership or governmental efforts as far as the next stage of their career. The transition for individuals who participate in this fellowship starts on day one as you meet with your fellows. You meet the rest of the team in the DICP, and you start to think about what that year is going to look like, whether it's with gaining that MPH or the MPP. But really, the growth continues well beyond the fellowship. Many of the individuals that you heard from before talked about their experiences during the fellowship. But Dr. Pinkney talked about the 6 months after the fellowship and how her careers really had that positive trajectory. And even more happens with the networking and the relationships that are built even beyond those first 6 months and into the 35, 7, 10 years down the road. So the transition happens day one, but it continues throughout your career. I just want to double down on the fact that, getting a additional degree is great, but I think the experiences that come from this fellowship are really what matter People come into this looking at an opportunity to get an MPH or an MPP, but it's really the totality of the experience that comes along with this. And I think the School of Public Health and the Kennedy School offer an amazing program. And there are great learning opportunities that you can get, but really it's the totality of the program that is going to make that make the big change in your career. I often tell people when I'm talking to them about the fellowship is, you come into this 1 year experience, but I think you leave with, a 5 to 10 year infusion of what a public health career would look like, just because of how compressed and active the year is going to be for you. And so as you're thinking about whether or not you are ready to apply for this fellowship, I think you have to really look at your career and think about, are you ready for change? And are you ready to be uncomfortable with the change that may occur? Because as you leave this fellowship, you may be in a different direction, going in a different direction than you originally planned, but that's not necessarily a bad thing. I think it's an opportunity for you to come in, learn about health policy, learn about how to be a change agent, how to be a leader, and leaving out with skills, knowledge, attitudes that are really going to prepare you for the next phase of your career. So with that, I will stop and turn it back over to you, Dr. Reed.
Thank you. Thank you, Alden, for that. The Q&A is open for any questions that anyone might have. There are some that have already come through. I'm going to begin with one, but really hoping that all of the participants on this can answer some questions. And one of them is just around, is it restricted to U.S. citizens? As I'd mentioned, it is restricted to U.S. citizens and permanent residents. So green card, individuals who hold a green card are eligible. And it also asks people living and practicing in the U.S. At the time of application, you do not have to be living in the U.S. We've had fellows who are in other continents, other places, who applied and then came to the fellowship. However, it is an in-person fellowship, and you have to reside in this area, be present for all of the fellowship during the time of the fellowship. There's another question about, are fellows allowed to practice clinically, moonlighting or doing other things during the year? It is a pretty rich fellowship in terms of time, but I'm particularly looking at Jody and Jessica. Maybe you could speak a little bit about the time it takes in the fellowship and doing other kinds of things.
I can start. Yes, the fellowship, one, I'll say, I'm in a unique position where I'm doing it over 2 years, but it's because I'm doing 2 fellowships that is happening in conjunction with the Commonwealth Fund Fellowship. So it's a collaboration in addition. And then what I would say is, the fellowship is such a rich experience over the whole year. And I think in order to get as much out of it as you possibly can, it really requires you to be fully present, fully engaged. And in addition to being fully engaged with the fellowship activities, you're also taking courses. So I know some people, depending on your time frame and whatever personal things that one needs to do, maybe it might be possible to moonlight here and there. But I do think I'm doing it part-time, which has allowed me to have some of my clinical time. But I believe it's a little bit harder if one were to do it full-time to fully engage in fully committed clinical schedule. But maybe moonlighting might be a little bit more easier, just given more flexibility in choosing certain times to pursue clinical activities. But I do think being engaged in the fellowship as much as possible is really important, that I would highlight for the year.
Thank you, Jody.
I did it over a year, and so it was quite rigorous with both the coursework and the fellowship activities. I was fortunate enough to maintain some clinical activity at Mass General during that time. However, it was a unique situation where I had already done some of the summer courses, and so that allowed the time. I'm not sure if, I did not have that before, if the 6 weeks would have been that doable for me during the actual fellowship, because at the same time we're doing coursework and we're doing the fellowship activities, you're also thinking about the year beyond that. So I was also applying to jobs, and that also takes time. So you really have to structure it out. At the end of the day, communication is the most important thing. Make sure you're communicating any challenges that you're going through or ideas that you're having to Dr. Reed or Dr. Landry, and they'll be very supportive to support you the best way they can.
Thank you, Joy. Alden, do you want to add anything to that?
I
You've seen
do.
many fellows over time, so.
Yes, I think one of the important things to remember is that this is a unique opportunity, and you want to make sure that you are fully invested in this experience. And I would encourage all of you to think about where you are in your career, where you are as far as your comfort with your clinical practice, and be in a position where you can dedicate as much time as possible to this experience. I think the people who are doing this fellowship really think about moonlighting for a couple of reasons. One is to make sure that they can keep their clinical skills up, especially in spaces and places where they may be doing a lot of hands-on procedures, things along those lines. And I can understand the importance of keeping up your skill set. But hopefully you have had enough experiences through your residency and other times in practice that you can keep that skill set up while you take this time during the year. I think the other reason why people think about moonlighting is from a financial perspective, because the cost of living in Boston. And while it is relatively expensive to live in Boston, you have to remember that this is a short-term sacrifice for a year. And after that, you can make sure that you replenish your bank accounts so that you can continue to move forward with your comfortable quality of life. All that being said, our goal is to make sure that you have the best experience here in the fellowship as possible. Many fellows come in with the intentions on moonlighting, but once they see the rigor of the schedule and the experience that they're going to be having over the course of the year, they really downshift that. Excuse me. Well, other fellows come in and they do a little bit of moonlighting, but that's understanding that the priority for the year for them is going to be the fellowship and how to maximize this experience, and using some of the downtime that happens with the School of Public Health or the School of the Kennedy School during the breaks when they're not fellowship activities to maybe find some time to do some additional clinical work.
Thank you, Alden. There's questions here about sort of business days allocated to travel or the activities and how many days away. I would say it's not a lot of days away. The fellowship really begins in the summer, where fellows take about 10 credits towards the credits required to graduate. Frees up time for them to work on their practicum and do fellowship activities during the course of the year. That travel is for the site visits, say, to Washington, to New York City, and visiting a Commonwealth Fund, at the major kind of travel, or some of the national meetings. But it's not a lot of days or a lot of time away from the fellowship. And I think if you added it all together, it would probably be less than 2 weeks of time away from Boston and the program. There is another question here about finding housing. And does the fellowship help you find housing? And I could say the fellowship itself does not help you find housing. There are offices within Harvard that can help you some. And I would say fellows help other fellows. It's been interesting to watch them transfer apartments from one to the next. But maybe you can talk a little bit, some of the individuals here, about how you found housing or suggestions for how people find housing for the program.
One of the things that is offered through the School of Public Health, and I'm sure through the Kennedy School as well, are resources to find housing. There are some limited dormitory spaces. So if you're comfortable going back to that style of living for the year, you can take advantage of some of the programs that are available through both the Kennedy School and the School of Public Health. But as Dr. Reed mentioned, the fellows are really a network, and we've supported each other in finding housing. Fellows will be finishing up and transitioning out of Boston. And it's really a great time for people to swap apartments, continue leases, and so on and so forth. Housing in Boston is tough to find, but it is actually very doable if you take advantage of the resources, especially within the fellowship network, as well as the resources that are available through the institutions that you're going to be joining.
Thank you. There are a couple questions here about individuals who are parents, caregivers. Have any of our past fellows been caregivers in any way? A concern about being in a program full-time and also taking care of family. And I will tell you that there are individuals who have come into the program with family, with children or others that they're caring for. There's others who've come into the program and had children while they've been in the program. It's been both. And maybe some can speak to part of that. Alden, do you want to start? You've seen both sides again.
Yeah, I have. I think these are both great questions. We are all parts of family within the fellowship, and some of us has had to deal with the growth of our families during the time within the fellowship, and also the loss of family members during this time. And I think the biggest thing that you all should know is you're joining the DICP family, the Commonwealth Fund family, and we're going to support you regardless of what your situation may be. We have had fellows who've come in with families, and I have to say some of those fellows are really the most committed because they know that they're taking this time as a sacrifice to being away from their family, and so they really dedicate those hours that they're here to do as much as they can, so that when they do go home, whether it be for the long weekends or for the longer breaks that we have, that they can have that downtime to be with their loved ones. We've had fellows who've brought their kids to one class that we teach at the School of Public Health, and even the fellows and their children still talk about how that was a transformative experience for their child, because they felt their children were also a part of the program just as much as they were part of the program. So whether you decide to leave your family at whatever location that you're at now for the year while you're up here in Boston, or you bring your family with you for the year. Those are both viable options, and I'm always happy to talk with you about what those options may look like. We can talk about schools and places to live in Massachusetts, and opportunities for your children while you're here. But all of that is something that we consider, recognizing that many of us are coming at this at that stage where we're in that sandwich generation, where we're raising our own children as well as potentially caring for our aging parents.
And there's an understanding of that, and an understanding and a support for individuals. I think you'll find support both from the administration and leadership of the program, and particularly from other fellows who find themselves in similar situations. There's questions with regard to the Kennedy School. As mentioned before, there's application to either the MPH at the School of Public Health or the MPA at the Kennedy School. The MPA and the Commonwealth Fellowship are eligible for those individuals who already have an MPH. So if you don't have an MPH already, the Kennedy School is not an option for this fellowship program. The MPA program at the Kennedy School has an expectation that you'll have been out working, practicing in some form for about 7 years. If there are questions, if you say, I'm not quite 7 years, I'm 6 years, questions, is this eligible? I would say for that, to contact the Kennedy School directly to have a clearer understanding of how they would view your time. Because you remember, you have to apply to and get accepted to 2 programs, both to the Commonwealth Fund and the School of Public Health, or the Commonwealth Fund Fellowship and the Kennedy School of Government. If not accepted to the School of Public Health or the School of Government, then the eligibility for the Commonwealth Fund Fellowship is not there. You have to be accepted to both. So it's not possible to be accepted to the fellowship and not be accepted to one of those graduate schools at the same time. There's a question about, can you provide advice for applicants that are truly passionate about health policy, eager to develop skills and tools, but yet may not have the resume involving extensive health policy projects and publications? And I would love for the individuals here to speak. I will tell you, the fellowship is not looking for you to be a already formed leader and expert in this field and this space. This is a program about helping you to grow into your own leadership and your own direction and find your own place. But Jessica, Jody, maybe you can speak to parts of this. Do you have the CV of a health policy leader as to be able to get into the program?
Yeah, absolutely not. I would say it was a lot of learning that occurred during the program. I would say I had essentially a very minimal understanding of the multiple tiers that affected health equity in this country and beyond and globally. And it was really the tools that this training program taught through the fellowship and through the degree that equipped me to have a better resume on health policy on health policies. But to get in, I think you are getting in to learn those skills. They're not looking for you to already have those skills.
Exactly. I completely second everything that Jody said. I had no publications in health policy. I just knew exactly as the person who asked this question, I was just super eager and excited. And I was like, I just need an avenue in order to pursue this interest and teach me the ways that I can go about pursuing health policy initiatives, projects, or publications. So yes, you do not have to have publications or the skills and the tools you don't already need to have them. I just think you just need to have the passion and the eagerness to want to learn and soak in as much as you want. So I think it's going through this fellowship currently that I'm like slowly picking up all these skills, these networking opportunities, these connections, and I'm excited for like the opportunities once I get fully out into the world.
And just to add to this discussion, one of the things that's really helpful about the application process for the fellowship is that there are opportunities to help us to understand who you are in your direction as part of the application with essays that you have to write. It may seem like a lot of work and very tedious, but it really helps us as the leaders within the fellowship as well as the selection committee to see who you are in the direction that you're going. So be sure to take your time with those essays and help us to see that passion that you're talking about. Because we understand not everyone has had the same opportunities, not everyone is coming from that same space or place in their career. With some people being fresh out of residency and they haven't had the robust opportunities, whereas others are coming at it from a mid-career perspective, where they've had some opportunities, but maybe not necessarily in the space of health policy. So help us to see the picture by taking your time on those essays.
There's two other questions. I'm going to sort of combine them here as I'm looking at part of the time, and one of them is about have fellows applied to the program more than once, and I think it relates to a little bit to the last question. And there's individuals who did not get in the fellowship the first time, who have come back and reapplied, and in the same way that the skills are not expected to be in place before you apply for the fellowship. But there is expected to be a deep commitment to vulnerable populations, to issues around minority health or health disparities. And sometimes it takes time for people to understand what that means, to understand are they not really committed to it? What have I done in this space? Looking for evidence of having sought leadership opportunities. Doesn't mean that you have to be the chair or the president or already a professor, but what have you done to try to move the needle forward in other ways? And so people have done some of that, come back and had a clearer idea of why they were doing the fellowship, what they wanted to get out of the fellowship, and how to move forward. So yes, people have left and come back. Another individual in this same space was talking about, they say they're in South Korea. This looks like a wonderful experience. And is there a way for this to be for individuals from developing countries like themselves? As I said, this program is for US citizens or permanent residents. There are many fellows who are first generation. There are fellows who were born elsewhere. Jody talked about being born in another country. So there's really a mix, but that requirement about citizenship or permanent residency still exists. This is when will the application decisions be made? You've heard that applications are due by December 1st. By sometime in March, before the start of April, we're trying to make sure that you know about your status sometime in March so that you can make plans. for your travel to Boston and finding housing in Boston. And every fellow over the past 28 years has found housing in Boston, so it is possible. Have faith in that. Are there any closing words that you'd like to make from Lori or Alden, Jessica, Jody?
I'll just quickly say to everyone that's listening in and thinking about this opportunity. I mentioned this early that this is an opportunity for an inflection point in your career if you're ready for that experience. When you are making the decision to apply to this fellowship, really think about why this opportunity would be impactful for your career. Think about the patients that you've cared for, the situations that you've seen and witnessed within our healthcare system. And think about how you want to be a part of moving that needle forward and being a change agent when it comes to health equity, using policy as a lever to make those changes happen. And if this is the right opportunity for you, feel free to reach out to us so we can have more information exchange and help you to make the right decision about applying to this fellowship.
Thank you. Lori?
Thank you. I just want to say this is an exciting opportunity. There's so many examples of leaders that have come through this fellowship, including the president of the Commonwealth Fund. So please apply, share it with your network. We'd be really excited to have you.
Thank you. Jessica, Jody, thank you for being here today. Lori, Alden, Mary, who had to leave to go do another program at the same time. Thank you all for being here. Thank you for your support of the fellowship. Thank you all for joining us this afternoon. If you have any questions, you can contact the fellowship office at 617-432-2922. You see it here on the slide. You can visit our website or send us an email for any further questions about the application. Again, thank you for joining us, and we look forward to receiving applications from you. Have a good day.